Now, what do you think of that? Fun, enjoyable, but also dangerous. When you go in with your head goes in first, that is when you have the highest chance of developing a spinal injuries. Now, spinal injury is not common. However, if someone got it, it's going to be a very debilitating and devastating disease. The higher the injury level, the worse will be the outcome. And most victim is in their prime time. They are young, they are fit, and they can do a lot of things. So when they get injured or they're having spinal injury, it will be a very significant loss to the workforce, to himself, to the family, to the community, and also to the nation. Because it leads someone to paralysis. He becomes dependent from someone who is independent. The incident, however, it is not that many. Only about 40 per million in the States and about 15 per million in the UK. In Malaysia, the incidence of spine injuries from aquatic injuries, we cannot be certain because there's no record about it. However, the incidence of spinal injuries in a motor vehicle accident is about 19.8 per 1,000 victims, and 57.89% involve the cervical spine, because you know there are basically the spine itself can be divided into the cervical, which is the neck, the thoracic, which is the upper torso, then we have the lumbar, which is the lower torso, and we have the sacrum and the coccyx. But the one of the commonest place to have spine injuries is the cervical spine, which is the neck, and which is bad news. Now, spinal cord injury, however, only accounts for only about 5.3%, and the mean age is about 30 years old, where it peaks in the male between 20 to 24 and in the female between 25 to 29, and majority of the one who have spine injuries are male. Now, we need to suspect someone who have spine injuries. Now, what are some of the things in the history or the factor that is present will make you suspect that someone have spine injuries? These 6 are some of the factors you have to look for. 1, if there's history of diving, especially with the head falling first. 2, the victim is unconscious. So any unconscious victim you found, think of there might be a possibility of a spine injuries. 3, any injuries above the level of the clavicle or the shoulder. Now, if you have bruises, if you have bumps, if you have cuts, if you have any injuries above the level of clavicle, basically involving the neck and the head, you have to think there might be a possibility of someone have a cervical injury. Number 4, if you're complaining of numbness or weakness, he said he couldn't lift his hand, or basically he couldn't feel anything in the hand or leg, generally what we call as neurological deficit. We also need to think of spinal cord injury. Neck pain, okay, someone who complains of the pain in the neck, even there's no neurology deficit, spine injuries have to be suspected. Last but not least, if there's a high impact injury, especially with a whiplash. Now, whiplash is basically the head is flexed forward and then after backward and then backward and forward again. So like a whiplash. So from explosion from the boat, or basically someone push him quickly into the water from height, that also might lead to someone having spine injuries or spinal cord injuries. Now, the care of the spine is very important, and of all the parts of the spine that can get injured, the worst is the spine or the cervical spine or the neck. And why is this so? Because in the spine of the human being, you see that the most flexible or the most mobile region that can go flexion, extension, lateral bending, rotation, and everything is the cervical. All right. So therefore, making the cervicals the most easily injured area of all the spine or spinal vertebra. Okay, inappropriate or inadequate care to the injured cervical spine can lead to death or paralysis. And these are some of the important reminders. Now, for us as rescuers, I think the most important thing, we have to identify this thing early. All right. Now, and if the problem is that if we don't identify the thing early and we start to move the neck unprotected, it might worsen the whole situation. So therefore, it is important to aim in the initial part for victims who you suspect having spinal cord injury or spine vertebral injury is what we call as total spinal immobilization. All right. Now, what is total spinal immobilization? Is basically immobilizing from the neck, the trunk, the lumbar, right up to the coccyx. So this is what we call as total spinal immobilization. Because if you don't do that, it might have some medical and legal consequences. Now, for any rescuers, when they go and approach to any victims, yes, spinal care or protecting the cervical spine is one of the things that you will remember. However, in the water, because it's fun, because the process of getting the victim out of the water sometimes make some rescuer forgot about it. So when you forgot about it, that is when the things comes. The second thing is that something peculiar with aquatic injuries is that the indication to put or to protect the spine is not really clear, all right? And some of the time the technique is not well understood or not well described in a lot of the paramedic or rescue or textbook. And furthermore, not many rescuers know how to execute this procedure of protecting the spine, and therefore not much attention are being put into it. Now, these are some of the equipments that we can use to aim for what we call this total spinal immobilization. These are things what we call as adjustable cervical collar. All right, this is the equipment that we can use to immobilize the movement of the neck to a certain extent. But just cervical collar is not enough. We have to put the cervical collar on the patient's neck, and then after that immobilize the patient's head on the thing. This yellow thing that you see here is called the head immobilizer. Now, once you have to put the patient's neck with the cervical collar and then the head on the head immobilizer, this whole thing will then, the victim need to be basically strapped onto this red board. This is called an aquaspinal board. You're going to see all of this thing in practice. But basically, putting the cervical collar, the head immobilizer, and the spinal board or aquaspinal board is what we call a total spinal immobilization. And basically, this is how people work in the water. Someone is basically holding the patient's neck, putting the victims on the cervical collar, while the other team members is trying to help and keep the victim afloat. And then after that, the other team members come in and basically try to put on the head immobilizer and put the patient on this thing called the aquaspinal board. It's going to be fun. It's going to be difficult, but I can assure you that it is worth to practice this technique.